Hello and welcome to Let's Talk About Health, Hypertension, and Stroke webinar. My name is Connie, and I'll be in the background answering any WebEx technical questions. We have a few housekeeping items before we get started. If you experience technical difficulties joining the WebEx session, please dial 1-866-779-3239, or you can message the WebEx producer using the Q&A panel. During the presentation, all participants will remain in a listen-only mode, and as a reminder, this event is being recorded for rebroadcast. We will be holding a Q&A session at the conclusion of today's presentation. We encourage you to submit written questions at any time during the presentation using the Q&A panel at the bottom right of your screen. Please type your question into the text field and hit send, and please keep the send to as all panelists. If you are not seeing the Q&A panel, please click on the three dots to the right of the participant and chat bubbles at the lower right-hand corner of your screen. I would now like to introduce your first presenter for today, Donna Jacobs. Donna, you now have the floor.
Good afternoon, everyone, and thank you, Connie, as always. I do want to welcome everyone today to Let's Talk About Health, a community conversation that is offered to you by the University of Maryland Medical System Community Health Team. As Connie said, I'm Donna Jacobs, and I will moderate today's conversation. Let's Talk About Health has a few pointed goals. One is to increase awareness about important health issues, to help people maintain or improve their individual health or that of their family members. And third, to create effective communication between patients and medical providers. As you know, February is Heart Month, so today's conversation is about heart health, but particularly about hypertension and stroke. Heart disease remains the leading cause of death in the United States, and hypertension, also referred to as high blood pressure, can lead to heart disease and or stroke. Here to unpack all of that for us today, fortunately, is Dr. John Martin. He's the Assistant Clinical Professor of Vascular Surgery at the University of Maryland. He completed a residency in general surgery and vascular surgery at Parkland Memorial Hospital in Dallas, Texas. He's board certified in vascular surgery and a fellow of the American College of Surgeons. And he's held several leadership positions in vascular health and heart disease at several Maryland health systems. He's also the founder and president of Heart Health Foundation and the chief medical officer of Butterfly Network. Remarkably, he also holds a Master's of Business Administration from Johns Hopkins University, and he's a frequent speaker on these topics, including the Wall Street Journal live in Hong Kong and TED Martin. Before I turn the floor over to him, let me remind everyone that although this is virtual, this conversation is meant to be interactive. So as Connie said, please feel free to type questions that you may have into the Q&A box, not the chat, but the Q&A box. And Dr. Martin will be happy to respond to as many of those questions as we can during this time together. Of course, these questions should be general in nature, and he's not able to provide specific diagnoses or individual medical advice. Again, the conversation is being recorded. I'll give you more information about where you can get the recording and see these slides again in the next few days. I'll tell you that at the end of the conversation. As you see on the screen, we do set these conversations within the context of the Ask Me 3 model. And it's really a great way for people to ensure that they have a good conversation with their medical provider and that they're able to get and retain the information that they're given by their provider. It's often hard to grasp everything that you're given in what sometimes can be a really stressful conversation or time for you. So it's very simple. There are 3 questions to bear in mind. What is my problem? What's the issue? What's my problem? What do I need to do about it? And why is it important for me to do this? So as we go through, Dr. Martin will give you a couple of examples of how Ask Me 3 might work. But what we want you to do is just bear those questions in mind when you're talking to a provider. Those 3 questions. What's the problem? What do I need to do? And why is it important for me to do what you say? All right, and Dr. Martin, with that, I think I'll turn this over to you. And
Thank you
thank you.
very, thank you very much, Don. And I'm really thrilled to have the opportunity to talk with you today. My only, if you will, reservation is the fact that I can't see you in person. And when I give talks, I much rather actually see your faces to see whether you're actually getting what I'm saying or falling asleep with what I'm saying. So I'm going to have to assume that you're in the comforts of your home or your offices and you're listening, and hopefully you'll feel very comfortable actually sending questions in. I use this slide to talk about hypertension and stroke for a very important reason, and that is so often blood pressure is thought of at the surface level of being not that big a deal. So my blood pressure is a little bit high, maybe under stress, or it was a difficult day, and people don't really realize the bad things that are actually going on underneath the surface, much like an iceberg. And much like the way icebergs can actually take out ships, high blood pressure can actually take you out. And it is a leading cause of heart attacks, stroke, and candidly death. So paying attention to hypertension is really important. And I want you to remember this image of an iceberg and understand that it may look like not something much at the surface, but beneath the surface, it's something of great significance that you have to pay attention to. Well, everybody starts with a very basic question. What's normal? I mean, if we're going to talk about high blood pressure, isn't it important to kind of assess what's actually normal? And there's some interesting guidelines I'm going to walk through with you, but one of the really simple things to easy think about it is actually normal blood pressure is less than 120 over 80. Very simple thing to remember, 120 over 80. Now, all of you might be saying, well, wait a minute. My blood pressure is never 120 over 80. It's often higher than that. And that is actually the case. We're going to talk about a little nuance of this when we get to the next chart, because you say, when I go to my doctor, it's stressful, my blood pressure is higher. But elevated blood pressure is anything above that. So if you look at it, we talk about elevated blood pressure. If you get from 120 to 129, it's really considered high blood pressure if you're anything over 130. And then obviously we have higher stages if you're over 140 or higher than 180, which is a serious problem. So I want you to think about those numbers. Think about 120, 130, and 140. It's easy ones to actually remember. People often ask too, what's more important, the top one or the bottom one? I'll just say this to make it simple. They're both important. We used to think it was only the lower number that we'd pay most attention to, but actually both are associated with risks and complications. And so it's important to actually know both of them. Here's an interesting thing though, and that is we all recognize that the doctor's office is a bit of a stressful place, and that your blood pressure might be a little bit higher. So the International Society of Hypertension has kind of given you a little grace period here and said, we'll raise that threshold for the diagnosis of hypertension up to 140 over 90 if you're in a doctor's office. Okay. That doesn't mean you get a free pass if it's 150 or 160 and say it was just the doctor's office. So anything above 140 over 90 is considered high blood pressure. If you're actually taking it yourself at home, we'll give you a little bit of advantage there, and we're going to use 135. And if you're actually doing continuous monitoring, because your blood pressure will go up and down frequently, candidly, anything over 130 is high blood pressure. So we do give you a little bit of a pass for being in the doctor's office. But if you see your blood pressure significantly higher than 140, don't just pass it off as saying, well, I was in the doctor's office. Yeah, that is actually a sign that your blood pressure is higher than it probably should be. And there's things that you need to actually do about it. Well, who's at risk? I think that's a really important question. Do I need to worry about high blood pressure? Is this something that I have to be concerned about as a patient? Are there risk factors that make it more likely that I will develop hypertension in my lifetime? And the first one's a pretty easy one, and that's whether you're overweight or obese. And this is becoming a bigger and bigger problem in our country as you start to see almost the majority of adults these days are overweight or obese. And the pandemic didn't help. How about your diet? Well, your diet plays a big, I'm sure you've heard this somewhere along the line. You'd like to get out that salt shaker, give yourself a little extra flavor. Well, in goes the salt, the water follows it, and your blood pressure goes up. So generally, you really shouldn't be thinking about adding salt to your diet. And everybody knows more fruits and vegetables, less fatty foods is really the way to go. The other thing is actually exercise can impact your blood pressure. So regular exercise is an important thing to keep your blood pressure down. If you don't do it, you have a greater risk. We've all known for a long time that smoking is a risk factor for high blood pressure. Nobody should be smoking. And one of the most scary statistics I saw recently is that smoking and vaping in our teens is up 1,800%. So we have a whole new generation, unfortunately, that are smoking, and we've got to work hard, whether that's your kids or your grandkids. We got some work to do. One of the other things, which is a problem I have, and that is poor sleep habits. I don't sleep well. Getting enough sleep at nighttime is a critical part of this, and bad things happen to you if you don't get enough sleep. It's important for your body to rest. And so doing those things to get regular sleep matters. Too much alcohol or coffee. I had a hypertensive expert once who used to give a lecture regularly and say, you can have 2 drinks a day. That's kind of the maximum. You shouldn't have more than that. And I thought, that sounds like a lot to me. But that's what the recommendations were. What he also said was you can't save them up all week and have 14 on Sunday. Okay, that doesn't work. So try to keep the alcohol intake low. Now, all of those things are things you can control. There are some things you can't. You can't affect your age, although we would like to think we can, your race or your gender, and all of those have been associated with if you're older, if you're black, for instance, or you're a male early, your risk of high blood pressure is higher. You can't change that. But you can change all these other things, so it's important to pay attention to them. Well, how common is hypertension? I show you this picture on the right because it's incredibly common. And actually, when you think about people and look at the age brackets, it goes up significantly with each decade. And one of the things to remember to make it pretty easy, generally anybody 50 in their 50s has about a 50% chance. In their 60s, it's about 60%. And in their 70s, 70%. And this keeps going. Easy to remember. So it's a very common problem. That makes it typical for us to see, but it's still not normal. Okay, normal is not good. Now, why does this risk go up over time? What happens in our arteries is they become less elastic. Think of a rubber band that stops being very rubbery and becomes stiff. That's what happens in your blood vessels as we age. They start to get calcium built up in the walls. And so as your heart pumps, normally the blood vessel would expand and absorb that pressure. But when the artery's stiff, it can't, and it drives your blood pressure up. So that's why we see it more commonly in elderly people than we have young people, but it still occurs in young people. And this is a great graph that just shows this. As you age, your systolic blood pressure goes up, your diastolic tends to drop, and that has to do with the rebound effect of a stiff artery. So we see these kind of findings as people age. And what it makes me think of as a physician treating you, if I see an older patient, my index of suspicion for high blood pressure is higher. And so I want to pay very close attention to those elevated blood pressures I see in people in the office, particularly if they're not being treated, that they probably have hypertension and they may not be diagnosed yet, and it's important that we do. It's also important to understand differences in race. This is Black History Month. There are huge issues within the healthcare community and in health in general of the disparities between what we see in people of color and what we see in white people. And one of those conditions that are significantly more common in Black people is hypertension. And so if you're of the Black race, you certainly should be more sensitive to this issue. You should be more sensitive to those risk factors that you can control, because just by the nature of your race, you're at higher risk. So you need to be even more vigilant about those risk factors to try to lower the chances that you, in fact, suffer from high blood pressure. What are the symptoms of hypertension? You'll see on the left is the one that's most commonly there. None. You just don't know you have this unless your blood pressure is really, really high. And that's the problem. If you have something that's bad for you and there's no symptoms of it, what is the likelihood that you're going to do something about it? Not very much. We don't do a good job with things that we actually have symptoms for, let alone things that we don't. And so I think this is a really important one for you to remember. You can't just say, I feel fine, therefore my blood pressure is not a problem. That's just not the case. Now, really high blood pressure, there are some symptoms that are out there. Early morning headaches, frequent nosebleeds, blurry vision. You get lightheaded, particularly when you stand up. And even in more advanced cases, you'll see shortness of breath, nausea and vomiting, and your heart will beat real fast. All of these things, particularly the bottom 3, are typically warning signs of really high blood pressure. All of these things also can be associated with other things. So it doesn't mean if you have this, like if you get nosebleeds, you can be someone that has bad sinuses or dry nose. Doesn't mean you have high blood pressure. But if you have them, you should actually make sure that you don't have high blood pressure. Important to remember this. But the bottom line message to remember, the vast majority of people with high blood pressure have no symptoms whatsoever. So we start with this big question. If high blood pressure doesn't usually cause symptoms, how often should I get my blood pressure taken? Do I need to actually get it taken at the doctor's office? Or what about those machines that I see at the grocery store or a pharmacy? And should I get a machine at home? So it's a really interesting problem. So what's the problem? Hypertension is silent, and it does need to be measured to be detected. If you don't know what your blood pressure is, you don't know whether you have it or not. So you should get your blood pressure checked. The current recommendations are about every 2 years if it's normal. If you have high blood pressure, monitoring at home is recommended. And you can talk to your doctor depending on your level how often that should be. Now, I will tell you as a physician, and why is it important? Because if you don't monitor it, you don't know what it is, and you can't actually do something about it. So actually, persistent elevated blood pressure does bad things to you, and you don't want to leave it high. I can always tell as a physician when I see an engineer because they come into my office, they take out a piece of paper, it drops to the floor, and there are 4,000 blood pressures there because they measure it all the time. You don't typically need to do that. Twice a day is certainly fine if you're going to monitor it at home. Try to pick the same kind of time each day. In the morning, as you first get up, in the evening is another good time. Don't do it after watching the news because that tends to be stressful these days. Pick a nice calm time where you sit down and get it measured. But you do need to monitor it. And I think it's worth it. If you have significant high blood pressure on medicine, an investment in a blood pressure machine in your home is a good investment. And make sure that when you go to the doctor or actually you wander into the grocery store and you see that Higgy device, sit down and get it taken. It's a useful tool to have available and it's free. And so there are lots of options out there. This is the Higgy machine. You see it in lots of places. It's in Walmart's. It's in, I've seen it in Safeway stores. It's in Dollar Generals all across the country. Sit down, get your blood pressure taken. It's helpful. There's also a lot of free screening that are offered by many hospitals and healthcare systems, and I know Maryland does that as well. A Dare to Care program that we talk about is that as well. Take advantage of this if you haven't had your blood pressure done in a while. And there are lots of relatively inexpensive blood pressure monitoring machines that you can pick up that if you do in fact have hypertension, worth having at the home. So I would certainly encourage you to actually do this. You can't do something about something you don't know. You don't know it unless you measure it. So people often ask me, okay, I've got high blood pressure. Is the first step medication? I don't want to tell them I got high blood pressure. They're just going to throw pills at me. Well, that's actually not the case. There are a lot of things that you can do, and we talked about them. You can reduce your alcohol consumption. You can actually reduce your salt intake, shift to a healthy diet, lose weight, exercise regularly, less caffeine. And then there are specific drinks like tea and pomegranate and beet juice that actually can be helpful if you pick the right ones. So typically, when we see somebody with a mild elevation, we're going to try conservative things first. And typically, the recommendation is about 6 months. If you have very severe blood pressure, we're not going to give you that luxury of trying to fix it on your own. But if it's only mildly elevated, we don't necessarily just start with medication. Now, this is a pretty complicated chart that I put up there, and you might want to stare at it a little bit to actually take away with what it is. And if you look at the top, the big bar is all these people with hypertension, and there are 160 million people in this country that have high blood pressure. And if you look at this, only about 20% do we start with lifestyle modification that's enough. Medications are typically needed for about 80% of people. Unfortunately, you can look at the next bar down, and this is what I want you to focus on. You see the biggest box in the middle? That biggest box shows you that the percentage of people that are controlled is very small. The uncontrolled group represents almost 70% of people with high blood pressure. We're not doing a good job on this. And this is the fault of us as physicians, you as a patient, to be all over this. You need to get your blood pressure controlled. We're not doing a great job of it. We need to do better. And this is an important part of this talk today. Don't just say I'm on my medicines, I'm not going to worry about it. You not only want to be on medicines, but you want to be on medicines and controlled. That's an important step to take. So here's an interesting thing I get asked all the time. My doctor has me on 3 blood pressure medications. I don't like taking pills. I don't understand why I need 3 pills. Why can't I take just one? Very common question. Well, multiple medications are often prescribed to control hypertension. It can be confusing and difficult to keep track. It's not easy to take a bunch of medicines. That is a problem. Well, you need to speak to your doctor to why he chose their current medications. And I would also recommend get a pill box to arrange your medications in advance. Take your medications at the same time each day and record it. It'll make it easier. Why is it important to take multiple medicines? It's very simple. Generally, to control blood pressure, it's better off using a different medications at smaller dosage that work in different ways to control your blood pressure than one medicine at a big dose, because every medication that we have often have side effects. The bigger the dose, the more common the side effects. If you use lower doses in small combinations, you reduce the side effects and you control your blood pressure. And that is typically the case. For those of you that have ever watched the crazy wrestling on TV, you see tag team wrestling, and they often both get in the ring at the same time. Well, that's what medications are like. They're tag team partners working together in different ways to control your blood pressure. It's much better for you, actually, if you can do that than have a big dose of a single medicine. What happens if my hypertension is untreated? Well, heart attacks, stroke, kidney failure, damage to your arteries is significant enough that leads to plaque buildup inside your arteries or a dilation of the aorta or aneurysms. This is not a good condition. Hypertension does very bad things to your body. And in 2020, more than 670,000 deaths. It's a remarkable number of deaths had high blood pressure as the primary or contributing cause of death. This is something that steals your life, and it's something that you can do something about. And these things from vascular disease are life-changing. That heart attack, that stroke, kidney failure, amputation, you don't get a second chance after those things are done. Your life is dramatically changed. And so there's so much of our effort in our talk today is really about prevention, prevention, prevention. You don't want to have any of these things because your life changes dramatically. And high blood pressure is an important contributing cause. There's another thing I want all to notice, and then COVID had a dramatic impact on all of us in many, many ways. But one of the most important things it did do that you don't hear a lot about is people stopped paying attention to cardiovascular disease. They stopped paying attention to hypertension. And what happened was there's been a massive spike in mortality from cardiovascular disease because we've stopped going to the doctors. We didn't want to go there to get COVID, and people got to get back on track here. And I think it's critically important that we do that. So I say, oh my gosh, this could cause a stroke. Well, what is a stroke? It's a very simple explanation that I use in commentary. It's when part of your brain actually dies. So literally, it's death of a part of your brain. There are two major types of stroke that we think about in medicine. One is an ischemic stroke, and that's when the blood vessel itself gets blocked or is narrowed enough so it blocks off the blood supply to a specific part of your brain. By choking off oxygen, the tissue dies. There's also a hemorrhagic stroke where you bleed inside your head, and that's what happens when a blood vessel ruptures inside your brain. Two different kinds of strokes, treated differently, both can have the same kind of effects, and that is you lose neurologic function. And the ischemic strokes are much more common than the strokes that come from a hemorrhage, and hypertension, unfortunately, causes both. If you look at this picture, there are about 140,000 Americans die every year from a stroke. This is devastating to me because so many are preventable. Every 40 seconds, someone in the United States has a stroke. And if you think about us and we look at our family members, 4 out of 5 American families are touched by stroke. Somebody's had one, friend, family, loved one. And it's interesting, if you just have one, you're not one and done. 1/3 of all stroke survivors will have another stroke within 5 years. It's so important to actually stop this from happening in the first place. And a special message out to women. Actually, stroke kills twice as many more women than breast cancer every single year. You guys are really good about Pink Month. You're not so good about this one. And women count for about 50% of strokes, but the majority of the deaths, which is interesting. And if you look at younger women over 30 who smoke and take oral contraceptives, they have a stroke risk 22 times more than average. And so this is an important thing for women to be actually aware of. And the beauty of that is that if you dial in on this, women drive most of the healthcare conditions in families. You can help us, the men in the house, to actually do a better job as well. What are the symptoms of a stroke? Important to know that. Sudden weakness or numbness on one side of your body, your face, your arm, or your leg. Sudden difficulty speaking. A visual change in one of your eyes. All of a sudden you can't see well out of one, and it can be short. Sudden loss of balance, or a sudden really severe headache different than anything you've had before. These are symptoms of a stroke. So, good question. Stroke symptoms seem rather vague, and they are. I don't want to go bother the doctor or go to the hospital if it's nothing serious. Here's the problem. Stroke symptoms can be very transient or mild, and patients often wait at home for long periods of time for going to the hospital. It's interesting. In one study, the median time, average time people had symptoms and ultimately went to the hospital, 13 hours. That's a long time. So what should you do? Err on the side of caution. If you have those symptoms, don't wait for your doctor the next day. Don't hang around and see if they're going to go away. This is a situation where you dial 911. You worried about it. You're really seriously concerned about it. You're better off with an unnecessary ride in the ambulance than you are staying at home. And why is that important? Because time is a critical element in the treatment of strokes. There's medications that you can get that can be given if patients get there soon enough. The longer you wait, the more brain cells actually die. Every minute, 1.9 million brain cells die. Every minute. It's remarkable in that ischemic situation that that is the case. You don't want to hang out at home. It's just not a good decision. And if you have a stroke, it has devastating effects. Only 10% of stroke victims recover completely. 40% have moderate severe impairment, and 35% require nursing home care or die shortly afterwards. This is not a little mild problem. This is a huge problem. And any of you out there that know somebody that have a stroke know how devastating this can actually be. You can be the person who has an impact on the outcome. If you present to the hospital, we used to believe it's 3 hours, and I keep saying 3 because I want people there. They've squeezed it out now to 4.5 hours, but if I tell people 3, they get there sooner. You may be eligible for medications that make a big difference. And the other interesting thing is high-tech, high-touch stroke rehab centers are coming up all over the country that can have a huge impact on your recovery. How hard you work in rehab has a significant impact on what you recover. But I'll say this, and I'll say this all day long. The best way to recover from a stroke is to never have one in the first place. I want to leave you with a couple other quick things. Ischemic strokes, 50% of patients of ischemic stroke have blockage in the carotid arteries in your neck. Plaque breaks free, goes up into your brain. That can easily be detected with ultrasound. High-grade blockages can be fixed by surgery or a stent and dramatically reduce your risk of stroke. And 1/3 to 2/3 of patients have no symptoms at all before they first have a stroke that have carotid artery disease. So this is something that you could get checked to reduce your chances of having a stroke. And that is why we built this particular program. Get out your pens, 410-573-9483. It is a vascular screening program that's there. You will have your carotid arteries checked, your blood pressure checked. We also check for an aneurysm in your belly and the blood flow in your legs. If you are of an eligible population, anybody 60 and older or 50 and older with those risk factors that we talked about, high blood pressure, high cholesterol, diabetes, or smoking, you can get a free screening. But at the end of the day, as you look in the mirror, whether you're young or old, you are the most important tool to control your blood pressure. You have to take this seriously. You have to understand why knowing what your blood pressure is and following it and taking your medications, because at the end of the day, you have to be the advocate, and you can control your blood pressure if you work well with your doctor and you pay attention to the things that we talked about today. So I'll pause there and be happy to answer any questions. We could certainly talk all day about each one of these different subjects. I hope this gives you kind of an overview of something to think about, and you walk away with the idea, I'm going to know what my blood pressure is, I'm going to check it regularly, and I'm going to make sure I get under control. And I'll stop here, Donna. Thank you.
Dr. Martin, that was fantastic. And clearly your passion about this shows through. I'm sure you have spurred many by your comments to be more vigilant or more proactive about their current situation. And that's the point of this also. Thank you so very much. There are some questions coming in. Let's jump into those. There's a question here about caffeinated drinks. And do all caffeinated drinks have an impact on your blood pressure, or is it just coffee?
No, they all can, and I will confess to being a little bit guilty at times of drinking caffeinated drinks myself. Um, I think obviously anything we do, you do in moderation. If you're drinking a ton of coffee during the day, that's bad. Single cup of coffee in the morning is not a terrible thing. In fact, there's some good studies that show caffeine actually may be good as long as if it's not synthetic caffeine. So there's not a difference in the way that caffeine hits your system in the sense of raising your blood pressure. Just do it in moderation.
Okay, so a lot of questions coming in now, and they're good ones. Let's see. They're coming in. It's keep popping me out because they're coming in so fast. So different blood pressure cuffs seem to provide different readings. You mentioned using the drugstore cuff. Oh, wait a minute, they're popping me out of here. And which often varies from what you get in your reading in the doctor's office. How do you know what size cuff is appropriate? How do you know which reading is correct?
Yeah, so one of the recommendations we come and do is take your blood pressure 3 times when you're doing it at home because you will see some variability. You want to make sure the cuff fits well. It's not too small or too big because that will actually affect the blood pressure in your arm. And also remember, the setting, the level of activity of what you've done will affect your blood pressure. There shouldn't be wide swings, of 30, 40, or 50 millimeters of mercury difference. You may see swings of 10 millimeters either way. That's not uncommon. But write them all down, write the circumstance down. The other thing I always tell people to do is if you buy a blood pressure machine, take it to your doctor's visit and have them show you the right way to do it. Make sure you have the right size cuff when you're there, and they can help you. And then you can get more comparisons to what they do there. And I think that's the best recommendation for people that are going to monitor their blood pressure at home.
You just hit on something that impacts another question, which is, what if you are monitoring at home and say within a half an hour you see vast swings in the reading, 170, 150, 129 within, 30 minutes? What do you make of that?
So if you typically look at, first of all, if you started at 129 and you're taking it 2 more times in the next half hour, I'm gonna tell you, stop taking your blood pressure and
Well, the
get
reverse.
a
High
good number and
first.
stop.
Okay. No, it's high first, they're
I
saying.
first, and then I want you to follow it. I think it makes sense. And actually, if you look at people that do continuous blood pressure monitoring, it looks like the stock market. You will see fluctuations that are there. I don't get too excited unless you start seeing numbers in that 170 and 180 and persistently there. You're going to see every once in a while those numbers going high. If they stay high, get concerned. If you drop back down into the 120s, that makes more sense. That's where I want you to be. But you should record those numbers and bring them with you when you go to the doctor's office. You're going to see some variability in your blood pressure. It's the persistently high stuff that should get your attention.
Okay. And so here's a question. Is there a test after you've had a stroke that can tell you whether or not you've had past strokes? I think the answer to that is yes, but go ahead.
Yeah, the answer to that is yes. You're perfect. And there are tests that an MRI and special CT scans can actually tell you. I wrote a paper once about carotid disease. One of the first papers I wrote is I looked at a whole group of people that had blockage in the arteries in their neck from various amounts. And then we got CT scans on all of them. And what was interesting to see is you could see that as the degree of narrowing went up, the frequency of silent infarcts, i.e., it hit a part of your brain that you didn't actually have an impact on or notice, and actually that happens. So there are silent infarcts that happen. I called the paper a lucky shot because if that clot that goes up into your brain or piece of plaque goes to a spot that you don't typically use, you kind of get away with it. Or if you have if you will, a transient stroke at nighttime when you're sleeping, you would never know it. Your brain does a pretty good job of recovering for these little tiny ones, but people very commonly have multiple strokes.
You mentioned earlier, and this is a question that I have, I think I've heard this before. You talked about removing a blockage in the carotid through surgery. Are those surgeries equally effective for men and women, or are they more effective in men? I thought I
They're
heard.
actually equally effective in both. The nuance you see in this is there's a slight increased risk of narrowing coming back in women, and we believe fundamentally that's because their arteries are smaller. But they're equally effective in both. You just want to find somebody who does it well. And there are a couple different procedures today that are being done that you might have one versus the other depending on the circumstance.
Question, if you have sleep apnea and high blood pressure, are you more at risk for stroke?
Yes, but it's sleep apnea. You want to make sure you use the device. It's incredibly important that you do. But the answer to that is yes.
And here's a question that we're probably all thinking. How are stress and hypertension related? Any suggestions for stress management? It's not funny. It's, we're
Oh,
all
no, it's okay because I'm sitting here thinking, rubbing my ears, say, "Ooh, let's relax and be stressed." Lowering the stress in your life matters. It really does. And so, excuse me, what happens in stressful situations is your body releases something called catecholamines. Basically, it's to actually, the purpose of it is actually to speed up your heart rate, raise your blood pressure. It's the fight or flight mechanism your body has from way back in the days when we were cavemen and women, where we had to run from tigers so that we wouldn't get eaten. And so, lowering stress lowers your catecholamines and lowers your blood pressure. You should really look for those things in your life that cause stress and find ways to either A, avoid them, or develop tools where you can mitigate the stress and find ways for it to bounce off of you or pass right through you. Obviously, the Zen of meditation is really good. Yoga is really good. Understanding that there are things in your life you can control and there are things that you can't. Getting stressed about those things that you can't control is not healthy. And you got to find ways to cope with that better and look for classes and stuff on how to help with that.
Does taking low dose aspirin daily impact the risk of stroke? I guess positive or negative?
Yes. So if you, for instance, have build up a plaque inside your arteries, let's say you have cardiovascular disease, and it can be in different areas. Low dose aspirin reduces your risk of stroke by 25%. So you want to make sure that you're a good candidate to take it. You can discuss this with your doctor. There is some new data out that the more elderly patients, maybe greater than 75 or 80, the balance of risk of bleeding versus reduction of stroke may not be quite as good, but that depends on a number of different factors. But yes, low dose aspirin does reduce your risk of having a stroke.
Here's a question that I wondered today earlier and came up in my mind as you were speaking. This is a good one. How do you differentiate between between cataract blurriness and hypertension blurriness? You spoke about the risk of hypertension going up as you age, and so does the risk of cataracts.
So the typical difference is with cataracts, it kind of gradually sneaks up on you. I just came from the eye doctor yesterday who was looking in my eyes for cataracts and said if you get blurriness in your eye that gradually comes down over time, that is typically from a cataract. And if it's all of a sudden blurry, like 2 seconds ago I could see perfectly, now it's blurry, that's generally high blood pressure or something like that's going on, or could be the symptom of a stroke. When in doubt, go find out. That's the way I always try to tell people. But that's typically the difference. Unfortunately, in medicine, there are no absolutes, and that's why it's always safe to try to find out.
That's a great answer. Thank you. What are the most effective ways to reduce blood pressure quickly when it spikes?
Well, the most effective way are particular medications if you're on them. That is typically the thing that you can do. But obviously, sit down, calm, think calm thoughts. Um, but if your blood pressure is really, really, really high, that's a trip to the doctor's office or the emergency room because you have to be cautious about that. There are no real magic bullets for that one. It's really a matter of put yourself in a calm situation. If you take medication, make sure that in fact you're on the right medication. You've taken them that day. I think that that's really important. It's also important sometimes that if you're someone who tends to spike, to have that conversation with your doctor and say, hey, there are times my blood pressure goes up really high. Is there a medication, a little extra dose of something you would like me to take in those circumstances? That is often the case with beta blockers. You'll hear that and say, yep, take a little extra dose of your beta blocker. That would make sense. That's a good conversation to have with your doctor if you're one of those people that tend to spike up high every once in a while.
Is it normal to have a different reading in your right arm and versus your left arm?
So the short answer, is it normal? No. Is it common? Yes. And what typically, if it's greater than 20 millimeters of mercury difference, and both were done well, it typically can reflect there may be a blockage in one of the arteries going to the arm, and that's why you see a difference. And so that's something you bring to the attention of your doctor. If you have that situation, and it doesn't always have to be treated, but if you have that situation, which of the two blood pressures is the most important one to remember? Anybody want to guess?
The higher one.
The higher one, you're exactly right. So if you go to the doctor, you know that situation's there, remind them of that and hand them that arm to get your blood pressure taken, not the other arm.
Great. All right, here's a question here for someone who says, I have kidney stones and I'm seeing a urologist for that, and I've gotten a diet for the kidney stones, but I've gotten a different diet from my cardiologist. Isn't there one for both?
That's the conversation where you get the kind of two heads to get together and let's talk about it. And I will say this, kidney stones are not fun. They hurt a whole bunch. But it's generally not fatal, but heart disease can be. And so if you had to pick one, I think you pick the heart diet, but I think you can have a good conversation. And I'd start with a heart doctor and say, hey, here's the kidney doctor's diet that he suggested for me. Is there any way I can actually live in a world where both of these actually make sense? And that's the person I would have that conversation with.
Okay, a couple more questions here. This is great. Is 600 milligrams of calcium twice a day for bone density too much for a pre-hypertensive patient?
So I try to avoid any answering specific questions about doses of medications for individual patients because I think typically all of this depends on the circumstance. I don't think it's too much typically, but I think this is a question you ask your doctor who knows all the different parameters of your particular health.
And then you did speak before. This question has two parts. One was about the right arm and left arm that you just answered. But the other part of that you addressed a little bit. Maybe you can say more. Does a consistently high diastolic blood pressure signify a particular problem?
It is a part of hypertension. And so if you have it consistently high, it's something that needs to be treated. There's some nuance to blood pressure as to why one number could be higher than the other. But if you have a persistently high diastolic pressure, which does happen in certain circumstances, it does need to be treated.
Okay. Well, Dr. Martin, this has been tremendous. And I see No more questions at this point. Oh, wait a minute. See, here they come. As someone suffers, someone who, here, wait a minute. Okay, now there are more coming. As someone who suffers from migraines, I wonder about being able to tell the difference between a migraine and a stroke headache. Is there a clear difference? And I think
No,
I know the
there's
answer to that.
not, and it's a tough one. And the best way I can tell you, and I've had migraines in my lifetime, and the first time I had a really bad one, they thought I had a stroke. And there are specific migraines that actually mimic a stroke that are really scary. But I think as someone that has frequent migraines, I always tell you if it's different, if it feels different than what you usually do, if you don't know, then you got to go. And I keep going back to that one because I think it's important to distinguish that. But typically, migraine people know what their migraines actually feel like because they're typically pretty consistent. If it's out of the ordinary for that or the worst migraine I've ever had in my lifetime, get to the hospital.
Yeah, and the same for cluster headaches. For people who've experienced that kind of pain, they have the same pattern all the time. So I've been told before that you would know the difference.
Yes, you typically do know the difference.
Okay. And question, does it matter if you used a cuff on your wrist or on your upper arm?
It doesn't. What I like to say about this one is I would rather have an arm cuff than a wrist cuff myself personally. And there's some experts that argue a little bit about this. But if you're taking your blood pressure, it's a great first step. So I'm pretty excited about it. My preference always is the arm. That's why we do it in a doctor's office that way. We believe that's the most accurate. But if you're doing it and you do it in the wrist and that's what works best for you and you get it consistent and you take that number and compare it to what your doctor's doing using an arm cup and you have that for reference, I'm happy that you're taking your blood pressure.
And then a question, I think this is the last one. Can you tell us about statins and do they help prevent stroke?
The answer to that is absolutely. Statins, the interesting thing about statins, and I'll say something that's maybe a little bit of an exaggeration or hyperbole, but if statins didn't have side effects, they'd be in the water like fluoride. They actually do really good things for you. The medications itself, not only do they help lower your cholesterol, which is part of what builds up inside your arteries and one of the risk factors that we talked about for heart attack and stroke, but they also stabilize whatever plaque you actually have inside your artery so it doesn't rupture or break. So statins are good for you. So my patients that have blockage in the arteries, I put them on statins. I try to get them on the lowest dose possible that is successful. But yes, they're very good medications. Some people can't tolerate statins. That's typical. You can try different ones. You can take CoQ10 with it. You can stagger every other day. There are a lot of little tricks you can do, but statins in general do lower your risk of heart attack and stroke.
Okay, every time I say that's the last question, then some others pop in. So I'm going to take these three last questions if we can in the time. Would soaking in Epsom salt baths be beneficial for people with hypertension? I'm
If it,
postpartum and my blood pressure spiked and they put me on an IV magnesium sulfate drip. That one I know. Hmm.
yeah, that's preeclampsia or eclampsia, and that's what that magnesium drip's for. And that's a pretty unique situation within pregnancy and an important one and a dangerous one if left untreated. As far as the Epsom salts, I'll say the Epsom salts are great if it calms you down, but it's not necessarily going to affect your blood pressure. So I would look at it if it's soothing and relaxing and makes you calm and lowers your blood pressure, great. It's one of those things that's hard to think about something negative about that, but not necessarily what I would say is in the top 5 treatments of high blood pressure.
We spoke about caffeinated drinks earlier, and this question is saying, is there an effect from decaffeinated drinks? I think that's the question.
Yeah, not that I'm aware of, but again, sometimes things sneaks through the literature that I don't know. But the whole purpose of taking decaffeinated drinks is to stay away from the caffeine. So not that I'm aware of, no.
Okay, and then someone told me I missed a question, which is exercise is an important part of prevention. Can you talk more about the components of exercise, including strength training, that was mentioned in your presentation?
Yeah, I think you should do both. And I think you should do both. And you don't have to be Arnold Schwarzenegger and picking up the building every day, but having some kind of resistance training as well as aerobic exercise at least 3 times a week is a critical part of this. And I always stress the resistance things because it's typically not what, as we start to age, we do. Because we think of weightlifting as that young person's thing. Doesn't have to be big weight. You can use rubber bands. You can use the milk jug for that matter. Resistance training's very good for your blood pressure, very good for bone density. And I think it should be part of the regular thing you do. Get into a routine to do both. I tell people 30 minutes at least 3 times a week. I'd candidly be do it every day. It would be fantastic.
Can seizure activity in an older man on meds be a sign of uncontrolled hypertension?
I'm not an epilepsy expert, But I think anytime someone has a seizure that's recurrent, I certainly think about blood pressure. I think this would be a good question for your doc that you see for your seizures. I try not to wander too far out of those areas that I don't know a ton about. That'd be the first time I've been asked this particular question. So thank you very much for giving me some homework after this talk.
Is AFib related to hypertension?
It is related in the sense that, if your blood pressure is high, you may be more prone to kick into that, but it's more like AFib is an electrical problem with your heart. Now, obviously, if you take a lot of caffeine, your blood pressure is high, it can kick you there. But the blood pressure because your arteries are stiff is a plumbing problem. Your AFib is an electrical problem in your house, and so it's a little bit different. But again, that's something that's a sign of something's not right in your system. Make sure your blood pressure is well controlled because it doesn't help if you have high blood pressure.
All right, and this one will be the last question. And it relates again to aspirin. I know you can't answer particular questions, but maybe this one is general enough. We'll find out. Do you advise aspirin for someone with high cholesterol, hypertension, and diabetes?
The short answer is yes, unless there's some contraindication for them taking it.
Okay. This has been fantastic. Lots for us to think about. I certainly appreciate it. I know the listeners do as well. And several people have asked, we can go to the next slide, if this presentation will be available or the slides will be available. Yes, it will be. The next slide will tell you that where you can get this. I think it's the next one. Well, informational links. Let's do that first and then we'll continue.
Yeah, so I've thrown here a whole bunch of references for you. So if you get access to the slide, these are things that will take you to answer lots of questions. They're good nationally recognized websites that have very useful information from people far smarter than I am. They can answer your questions.
Okay. All right. So let's talk about health. We've been doing this for a while now, monthly, except during the summer months. You can get a copy, well, you can see this presentation again at the site listed there, www.ums.org/let's talk, as well as any of the prior sessions that have been held. So it'll be up in about 48 hours and you can see it all and you can review it and see the slides there as well. Next month's topic is actually quite related to this one. It's on kidney disease. And there are certain issues related to kidney disease that can also cause heart disease. So please come on back next month, again, the third Wednesday in the month, which is March 15th at noon. And once again, Dr. Martin, let me say a really hearty thank you for your presentation today and how flexible you've been with getting this up and getting this on. So appreciative of all of it and very informative talk. Thank you so very much. Everyone have a great afternoon.
Thank you. Have a great day, everyone.
You too.
Thank you, everyone. That does conclude today's webinar. You may now disconnect your lines.